So this is an important topic, and as we know, radical prostatectomy remains the cornerstone of management for regional prostate cancer. But there are many factors which affects the utilization and surgical candidacy for patients with prostate cancers. Some of them are able to go the prostatectomy, some of them are not. That's why we undertook the study to address this research question, like what are the clinical and demographic factors which predict the utilization of radical prostatectomy in patients diagnosed with prostate cancer. So for this study, we used the CS database spanning from 2000 to 2022, and we extracted about 1.2 million patients diagnosed with prostate cancer, and we did a multivariate logistic regression to see what factors, specifically the demographic, clinical, and socioeconomic factors predict the utilization of radical prostatectomy in these patients. And the results which we found were interesting. So the first factor that we found was age. As patients' age was higher, there was 10% less likelihood of receiving prostatectomy. The second factor that we found, it was a temporal association that starting from 2000 to 2022, each year the utilization of prostatectomy decreased by like 5% every year from 2000 to 2022. So there could be multiple reasons for that, maybe preference of alternative therapies like radiation or some other therapies might have contributed to it. The other factors that we found were patients who were married versus unmarried were twice as likely to receive the prostatectomy versus the unmarried people, which was an interesting result. Also, people who were residing in high-income zip quartiles were more likely to utilize the prostatectomy versus those who were residing in low-income zip codes. So another factor which was very expected, that the regional disease had 12 times more odds of receiving prostatectomy versus the patient with metastatic disease. So these are the core findings which we found from our study, and there are a few take-home points from the study that the utilization of prostatectomy has decreased, although like by 5% every year over the last couple of decades. There might be multiple factors, but the disparities exist between like age and people who are married and people of certain race and ethnicities. So we need to do targeted intervention to address those disparities and reduce them.